This morning we are joined by Lauren. Sorry, Lauren, if I say the last name wrong, but Lauren Carone. She's the Senior Director of Career Services at the College of Healthcare Professionals. And then we're also joined by George Colvin. He is a clinical manager for the operating room at Ascension Seton Williamson. And then we're also joined by Melissa Ibarra. She's a surgical technologist student with Ascension Health. So I want to give a big thank you to our panelists today for joining us. Today I'm so excited to hear all the great things that we're going to talk about during this presentation. All right. All right, so just to give everyone a little agenda of what to expect for this presentation this morning. So we're going through our welcome and our introductions. We just did our panelist introductions. Right after that, we're actually going to jump into a poll for our audience members. After the poll, it'll be about 1 to 2 minutes. We'll leave the poll open for you guys. It's a quick little poll, about 4 or 5 questions. And then we'll jump into some labor market information. And then we'll move into our questionnaire, which will be answered by our panelists. And then we will have a hand scrubbing simulation performed by Melissa. And then we will have a Q&A session. And then we will speak about spring updates that's happening at Workforce Solutions. And then we will thank you all for joining with us this morning, and we'll begin closing out. All right, so moving into that labor market information. So like I mentioned today, our webinar is on surgical technologists. So all the information on labor market will be based around this healthcare field. So on this screen here, it shows pretty much the top employers who are currently hiring for surgical technologists. And you'll also see different shades of green. So the darker shades of green are the healthcare and social assistants, and the medium tones of green are the professional, scientific, and technical services, and the lighter shades of green are the educational services, and our gray being the other. So just from looking at our chart here, Ascension Health seems to be our top employer who are currently hiring for surgical technologists, and this data is based in the Austin metro area, in case you were wondering. And then right after Ascension Health, we do have Baylor, Scott, and White. And then we have the Hospital Corporation of America. So I will give you guys a little bit of time just to look at the chart here. It looks like we only have one educational services for surgical technologists that's in demand at the moment, and that looks like it's University of Texas. All right, so then this is another portion of the labor market information. And on the left of my screen here, it's a graphic that shows surgical technologists, and it shows jobs that are closely related to surgical technologists, and then it shows jobs that are not so related to surgical technologists, but it's still in the field of healthcare. So if you're someone who's interested in going to surgical technologists, but you may want to explore some other fields, according to the chart, a sterile processing technician is similar to a surgical technologist, emergency room department technician, anesthesia technician, are all closely related to the surgical technologist field. But if you're someone who's interested in the healthcare field, but you're just not quite sure if you want to do surgical tech, you can branch out a little further as far as a radiologist tech, or radiology tech, or a registered nurse, or ultrasound technician. So this is a really cool chart to show what's related to the field and not so much what's related, but again, it's all within the healthcare field. And on the right of my screen here, it's a surgical technologist at a glance. So it pretty much talks about the salary here. So we see the median annual salary for a surgical technologist is about $38,000. And if we're on the other end of this chart here, 75% earn more than $34,000. And then on the higher end, it's about $43,000. And if we look down a little bit further, we can see the job postings in the last 12 months were about over 600, which is pretty much a lot of jobs. So we can possibly say that surgical technologist is in demand at the moment, and it also has a projected growth. See here on my screen, 20.8% over the next 10 years. So it is a career that is currently in demand, and it is expected to grow within the next few years as well. Okay, so I just want to introduce you guys to our TOL for surgical technologists. So on my left side of the screen here, what our TOL is our targeted occupations list. So at Workforce Solutions Capital Area, we pretty much outline which careers are in demand or which careers are currently targeted at the moment. So surgical technologists made that list for us. And then on this list, it's fun. We can provide funding for if someone was interested in going into the field of surgical technologists. So just something to keep in mind if you are a student who is wishing to pursue that route. And what the TOL is, it's pretty much a ladder. It shows where you can start in the field as a surgical technologist, and it shows how far you can go within the field. So you can start as a medical equipment preparer, and then you can move all the way up to a diagnostic medical sonographer. Right, so there's room for growth in the field. It's an in-demand career at the moment. And our ladder here pretty much details that here. Moving on to our next slide. All right, so now we're going to go ahead and begin with our questionnaire for our panelists. So for our first question here, for all of our panelists on the call today, can you briefly speak on your educational background and your job experiences that led to where you are now? And we can start with George because you're the first one I see on my screen.
Hi, healthcare is actually my second career. I had a career in high tech and working in corporate America. Went through one of those famous high tech layoffs and came back to look to joining healthcare. I was working as a nurse aide, thinking I was going to be an RN, and I found out about surgical technology, so I joined one of the community college programs, got my associate's degree. But it didn't stop there. After working in the operating room for many years, I decided I wanted to progress, and I went back to school, got my associates for registered nurse, but I've also gotten my bachelor's and master's in nursing, where I progressed into OR leadership. So now I actually run the operating rooms most days.
Nice. Thank you for sharing with us, George. Lauren, would you like to go next?
Sure. So like George, I started my career in the IT field. I was actually a recruiter for information technology for about 10 years. But unlike George, I am not a surgical technologist nor a nurse. I'm actually the Director of Career Services for the College of Healthcare Professions. And so my role is to assist our students and graduates once they complete their training with us to find employment out in the healthcare field. So I've taken my industry experience in recruiting and brought that to higher education. And so we do everything from assisting you in creating your resume to mock interviewing to discussing patient care, all of the things that make you job ready outside of what you would learn technically in the classroom. I have a bachelor's degree in marketing, but I too, like George, have kind of started at the bottom and have kind of progressed my way to the top. But I love what I do because I'm able to see students and other folks that are looking to start their career in healthcare actually take those steps to get their education and then get a job. So thank you.
Yeah, thank you, Lauren. And Melissa, I have you next.
Hello. Okay, so I actually started off about 9 years ago as a certified medical assistant. After I got out of high school, I went to obtain my certification as an MA, and I worked in the doctor's office for several years. And I knew I wanted to go back to school. I wanted to stay in the healthcare field. I wanted to stay helping people. So I told myself I wanted to go back and advance in something in a similar area. So that's when I found out what a surgical was. I researched it, and so I decided to go back to school after being an MA for several years. So that's why I'm a student now at College of Healthcare Professions to become a surgical tech.
Perfect. Thank you for sharing, Melissa. And Melissa, how long have you been in your program currently?
So it's a 21-month program, and I'm down to maybe about 4 months left. So maybe about 18 months I've been in the program, and I'm done with all my classes. I'm actually in clinicals right now. So I'm here at the hospital doing my clinical hours.
Nice. Thank you for sharing, and congratulations on almost being done. Such a
Thank
big
you.
And this question will be for everyone as well. So starting with you, George, what are your daily job duties and how has your responsibilities changed since COVID-19?
Well, the daily job duties of a surgical tech is we generally come in first thing in the morning and get our rooms ready for surgery, get the instruments and supplies pulled into the room, get open and set up for the sterile field, and make sure that when the surgeon arrives and the patient's ready, everybody can come to the OR and we can start the surgery on time. With COVID, we've really had to ramp up our infection control prevention. We all wear N95 masks. Where we have special ORs set up for COVID positive patients. All the patients are tested for COVID before they have surgery. So it makes us more aware of what's going on with the whole COVID vaccine pandemic going on.
Okay. And Lauren, the question's for you as well, but could you instead answer for us, how has the demand for surgical technologists has changed since COVID-19?
Yeah, absolutely. I mean, prior to COVID, Surge Tech was already extremely in demand. When we launched the Surge Tech program at CHCP back in September of 2019, before we even enrolled our first students, I had area employers and healthcare providers contacting us, asking when they could hire our graduates. And so unfortunately, I had to tell them they had to wait almost 2 years. But since then, you know, the demand fluctuated a little bit last year because some, you know, elective surgeries were put on hold because of COVID. But as things are opening back up, you know, there's still emergency room surgeries, there's still cardiac surgeries, and now elective surgeries are back open. So that demand is reaching what it was pre-COVID, and if not even more, you know, because of, you know, the need for that skill set in the operating room. So, you know, just a surgical technologist is someone that assists in the operating room, but I just want to, you know, make sure that anyone watching this today is aware that there's so much more. I mean, there's pre-op, there's during surgery, and there's post-op. And the surgical technologist, although you may not be performing the surgery, you are part of every single portion of that surgery. So there's a lot of involvement, and you are will be a key player in the success of that surgery and kind of be the right hand to the surgeon and the nurses in there. So it's certainly a job that will continue to be in demand as well.
Yes, well, thank you for pointing it out that, you know, that's not just surgery, that they work before and after, you know, to help the patient's wellness. So thank you for pointing that out. And Melissa, the question's also for you. So what are your daily job duties and how has your responsibilities changed since COVID-19?
So some of the daily job duties that we have is when we first come in and take a look at the schedule and we see what surgeries we have that day, we have to kind of go in the room, make sure everything, our equipment, make sure we do a wipe down, make sure it's clean so we can bring in all the sterile stuff and start setting up. So we have to make sure the room is ready, make sure we have everything we're going to need equipment wise, the amount of people to be there. We have to make sure everything's prepared. So once we bring in the sterile equipment and we start setting up our sterile field, we have to make sure that we're prepared even for the unexpected. So you have to make sure it's clean, make sure you open everything in a sterile manner, set up your sterile field, and then when the surgeon and the patient come in to the OR, then the procedure starts. You have to sterilely, apply your gown and gloves, be ready to assist with the procedure. So everything up to that point is important. You have to make sure you open your supplies sterilely because you don't want anything to be contaminated before you even use it. So make sure everything's ready to go, make sure the procedure, you perform the procedure, and then once the patient leaves, then you have to do the same technique, make sure you dispose of everything properly, get your instruments and prepare them to go down, to sterile processing. And then just from everything all the way until that patient leaves, you have to be very proactive on everything that you're doing, the way you arrange everything. So that's just what our job duty is: prepare everything, help with the procedure, and then make sure they, leave safely. And everything is just as important from when the next case starts as well. So I definitely think that some things that have changed with COVID, we have to follow more strict protocol when it comes to like our PPE. You have to make sure you have strict hand hygiene, wash your hands more often, more thoroughly. Make sure you're wearing the proper masks for procedures. It's definitely more stricter PPE protocol, definitely. Let me see, your scrub caps too. You get to wear scrub caps. Make sure all your PPE is up to date. Clean the rooms more thoroughly. Make sure you wipe down all the surfaces. So just stuff like that since COVID.
Mhm. Yeah, thank you for sharing with us, Melissa. All right, moving on to our next question here. So this question will be for Lauren and George. So beginning with you, George, what advice would you give high school students to prepare for a career as a surgical technologist? And what would you consider to be the top 3 skills needed?
Well, definitely, as the video said, you need, if you can take a medical terminology class, that would be helpful. But also your sciences, learning anatomy and biology and microbiology are all important for your career in healthcare. The top skills is attention to detail. Everything we do, there's a degree of paying attention to what's going on, especially as surgical technologists. They're trying to anticipate the surgeon's needs, and by watching the surgery and understanding what's going on, they'll know what instrument the surgeon's going to need next. Patience and a good attitude is what makes it work in the OR.
Thank you, George. Lauren, would you like to add to that?
Yeah, so just to add on to what George says, I mean, you definitely can't be someone who cracks under pressure. Operating rooms are high pressure environments. So if you thrive in that kind of environment, then that's going to be a good place for you. And with that said, you have to be flexible and adaptable. Because no single surgery is ever the same, and there's always going to be different variables for each patient. You may work under different surgeons, and each surgeon is going to want something different and want things done differently. So you really have to be open-minded to that. So that means you need to be a team player. But I would say most importantly for anyone considering pursuing a career in surgical technology is that you don't mind being exposed to blood, injury, wounds, or internal organs. Oftentimes we have prospective students come in and they think that this is the career path they want, and then we take them into our mock operating room and they see maybe a video being played of a knee surgery, and if they get squeamish, it might not be the right field for you. So make sure that that's something that, does not bother you. I think that's one of the most important skills to have for sure.
Yeah, definitely. I'm definitely not one for all the blood, and so I don't think I could do that. But for the people who can, that's amazing. So kudos to you for being able to endure a job like that. Thank you, and thank you as well. All right, so I'm moving on to question number 4. And this question is going to be for Melissa. So you can speak on your experiences as well, Melissa. So how are students prepared for challenging experiences once in the workforce as a surgical technologist?
I think students are prepared by so one thing you have to understand is that you have to be very adaptive. You have to be ready for the unexpected, for like challenges that you were not anticipated. So I think when we're in school, the teachers like to, our instructors, they like to give us like real life scenarios where they say, okay, this is what you're planning to go in as, but what if this happens? What are you going to do? So I think a way to prepare us is that we expect the unexpected, and we have to know whatever we're going to go in to do, you have to be ready for whatever possibility that could happen. You have to be ready for that to happen. You have to be adaptive. So you have to learn that you might go in with this plan, but this a totally different thing might happen. So I think definitely just being prepared for the unexpected. That's definitely a big thing that kind of helps us, be ready for real life in the OR. Um, just kind of just anticipating, challenges that may happen. That's definitely one of the biggest things I would definitely say that helped us prepare to be out there and being real. You have to be attention. You have to pay attention to detail. Be able to like constantly learn, observe everything that's going on around you, so you can just kind of be aware. You have to anticipate what could possibly happen. So just being aware of what can happen and being ready for the unexpected to happen. That's definitely how we get prepared in the OR.
Yeah, and I do have a side question to that to add on to Melissa.
Yeah.
Are your professors the one who prepare you for this field, or is it more so in the clinical route that you're more prepared for?
Um, so it's a little bit of both. Our instructors, they're very experienced, so they've been through a lot. So as they're teaching us like the book way and the right policy, as they're teaching us that, they also tell us, but also in the real life, they like to give us both perspectives. So we're learning the right way, but we're also hearing some real life experiences from what they have been through. So we kind of get a little bit of both at the same time, but that isn't a clinical matter. And we do those scenarios in the lab and during mock surgery, so we do get a little taste of it. But yeah, clinical is definitely, it's more realistic. It's real patients on the OR table. It's real blood, real everything you're exposing to. So I think it's definitely a little bit of both. It's definitely a little bit of both.
Yeah, perfect. Thank you for sharing. Okay, and on this slide we have some pictures that Lauren graciously shared with us. Lauren, if you would just like to explain some of the pictures that we see here on the screen.
Yeah, so I mentioned we launched the program back in September of 2019, and it was actually one of our employer partners, Ascension Seton, approached us and said, we have such a huge need for surgical technologists. How can we partner together? And so we did partner with them to build out and launch the Surg Tech program. So these are pictures of the actual mock operating room that we have on campus. And this is where Melissa is referring to doing the mock surgeries. And so the dummy that's on the table there, I think Melissa may be able to speak a little more to it than I can, but really there's everything from head to toe on there that they practice on before they actually go into a clinical setting and start working with live patients. So it's never going to be a scenario in which someone who hasn't been exposed to these mock simulations in our labs are going to be thrown out there into a real live scenario. There's a lot of practice and hands-on done in the classroom here. So we just wanted to show kind of what that looked like for a student environment. And then of course you take all of the things that you practice and learn there and so that you can be successful in your clinical rotations when you actually go to a hospital or surgery center.
Thank you for sharing. Melissa, did you want to elaborate on any of the pictures we see here?
I think being exposed to this in the classroom, it was amazing because it seems like a lot of instruments, but all this is really, it's realistic. You work with this many different instruments on different areas of the body. The machines that are there, I mean, I really think it's realistic. So that was very helpful. The fact that it feels like you're in a real operating room. So I think it's very close, very similar to it. The only thing different is that it's actually a real patient, but it's really similar. It's really similar. It's very helpful. The instructors are really good at giving you like real life scenarios, mock surgeries. So I think it helps a lot. It gives you a lot of confidence. So when you're out there in the OR, you remember, hey, I remember this. I remember these instruments. So it helped me be more prepared and more confident when I came to clinicals.
Nice, awesome. All right, so for question number 5, and Lauren, this question is going to be for you. So what education is required to become a surgical technologist?
So here at the College of Healthcare Professions, you just need a high school diploma or GED. So there's no prereqs or anything like that. So anyone that, is interested in pursuing in this field can, apply to join. And we start classes every 8 weeks. So there's an opportunity, throughout the year. We're not just on a semester basis. So as long as there's a high school diploma or GED, then that would qualify you from an educational background. And then of course it does lead to an associate's degree. And we also prepare our students with a certification review class because you are required to have a board registry to work in a surgery center or a hospital. And we want all of our students to successfully pass that. So it is part of the curriculum that you take the certification review class and, do mock testing and whatnot so that you're prepared for that registry and can start working pretty quickly after you complete your training.
Nice. And if students have their high school diploma and or their GED, is there an entrance exam or anything that they have to take to be accepted?
The only entrance exam that we require here at CHCP, I'm not sure of any other, what the requirements are for other institutions, but we do a scholastic kind of, what's it called, achievement. It's just a basic, test that you do to determine your level of competency. Because of the rigor of the program and some of the classes that are required in our different programs, we just want to ensure that our students, are successful and are able to, go through the program without any hiccups. So that's really it's a basic, just kind of comprehension test. And each of our programs we offer have a different score requirement for that. But that's about it.
Nice, yeah. Thank you for sharing. Because I know, some students kind of get nervous when it comes to taking those entrance exams. I, for one, am one of them. So it definitely helps to know that it's something to prepare you for the program, but definitely not something to scare you. But definitely, it sounds like your high school experience in education is definitely what is preparing you to take that test at CHCP. Moving on to our next question here. All right, and this question is going to be for George and Melissa. So George, I'll start with you first. So how do you prepare an operating room for surgery? What are the before and after steps?
Well, like Melissa said, the first thing in the morning, we clean the rooms by wiping them down. But each surgery has a preference card, which is like a recipe that tells what the surgeon wants, all those instruments and all the supplies, how to set the room up. So the scrub tech will look at the preference card with the nurse and start getting those supplies and instruments into the room, getting the room all set up and organized. We open the sterile field and the scrubs will scrub in so they can set up the instruments and the supplies. And usually that's 30, 45 minutes before the patient will even hit the operating room. And then after the surgery is done, they need to break all that down, take the dirty instruments to decontam to get cleaned, and sterile processing to get re-sterilized. They clean the room, which sometimes can be really bloody, and then get it ready for the next patient by getting another preference card and getting more supplies and starting all over again. And we may have one room do 7, 8 different cases in a day, or we might have a room that has a big long case and only do one case a day.
Yeah, thank you for sharing. Melissa, would you like to elaborate on this a little bit more?
Sure. It's kind of like what I was explaining earlier on what our daily job duties are. Like George says we have to go in and do like a pre-wipe down, make sure all dust, any kind of dust particles or dirt, anything is, it's a cleaning of the room before you bring in all your sterile supplies, everything in. So when you start organizing and laying everything out, it's as clean as it can possibly be. Open it in a sterile manner. So you have to open up everything very safely because if you contaminate anything, it could definitely get to the patient when you start using it. So you definitely have to open everything in a very sterile manner. Arrange everything in the way you're going to use it, how you can easily see and get to everything. So even if you're under an emergency circumstance and you have to be really fast, you have everything laid out where you can see it. You assist with the surgery. So when the patient leaves, you break down your room you have to still be in a safe manner. Dispose of everything that's disposable. All your instruments that are going to go down the sterile process, you have to pre-cleanse them. So do a pre-cleanse spray, kind of get the process started so the enzymes can start breaking down the blood particles. So by the time you send it out the room, it's already starting, its process. And then you have to wipe down the room again, get it nice and clean for the next patient. So just from start to finish, you have to make sure everything's clean, everything's organized, make sure you're paying attention to all the details, and that's how we get it before, during, and then after, make sure the room is clean for the next case. Mhm.
Yeah, thank you for sharing that. As you're speaking, Melissa, I actually have a follow-up question, George or Melissa, if you want to answer. Is there a certain way that the tray has, like, I don't know if I'm saying this wrong, please correct me. The instruments have to be set up for the surgeon. Like, do they prefer to have a certain instrument closer to them and ones further away from them, or does the order not really matter? So, how does the order look for that surgeon?
It depends on which surgeon and which surgery, but that's part of what we have a preference card for. It'll tell you what instruments you need to have up on your closest work area, which is our Mayo stand, and which instruments, if they aren't listed, you can kind of leave to the back. A little bit of experience also is what helps set that up. As Melissa's doing her clinical, she's learning that order of instruments and learning what supplies need to be closer to surgery. And so that's an important part of the education process.
Yeah, thank you for answering that, George. All right, so we're going to move on to our last and final question here, everyone. So this is for all of our panelists. George, we can start with you. So what is the most rewarding aspect of your job?
Well, the most rewarding is helping people. I've been on open heart teams and people come into the hospital in a heart attack. We're able to bring them back to the OR, do a cardiac bypass, and then they are up and well again, and they can have extended life. They get to return to their daily activities. I really like the OR because there's a good camaraderie. A lot of times we listen to music in the OR, and in the less stressful parts of the surgery, we talk to each other about what's going on, what are we doing this weekend, what are we doing for lunch, and so there's really good camaraderie in the OR.
I like how you mentioned you talk to each other, you talk to your coworkers. What are you doing this weekend? That's very interesting to know. And Lauren, moving on to you.
So I think everyone here can hear how passionate both George and Melissa are about being in this field and what they're doing. And so the most rewarding part of my job is to be able to see others through to this success in getting a career in something they are excited about, they are passionate about, and something that is going to be a long-term stable career path for them. That's why I do what I do, is to help others find their own success in what they want to do in their career.
for sharing. And Melissa?
All right, so it's kind of hard because there's so many, to me, there's a lot of different rewarding aspects of this field. Um, so like one of the main things too is like us surgical techs, we are the ones that we set up the whole field to allow the surgeon to be able to perform his job correctly. So if we weren't the ones to be able to set this up for them, these surgeons, they're doing life-changing, procedures, a lot of it, it improves like the quality of life for a lot of people. So being able to make that, make it, allow the surgeon to actually be able to do that just based on our setup and by us assisting them, that's a huge impact too. Like it feels great to be a part of that. Also, like in labor and delivery, being a surgical tech, you get to experience delivering babies. You assist bringing babies into the world, so you get to experience life in front of your eyes being born. To me, that was really amazing. I love L&D. So that's also a huge rewarding thing to be able to experience as well. Being knowledgeable too about like the human anatomy, knowing like the inside and outside of our bodies, the way our body functions are, that's pretty rewarding too, because you get to take that knowledge with you home. If you have a family, you have kids, you get to bring that knowledge about the body home, so you can kind of be a little bit more, have a little bit more of a healthy lifestyle because inside and out how your body works. That those are just some rewards. I mean, it's a very stable job. It's in high demand. So you're always going to need the healthcare field. This pandemic has kind of proven to us how the healthcare, the frontline workers, like it's really amazing the people who are, instead of running away, from the sickness, we're actually running to the action. We're there to help people in the most critical time when people really need us. So being somebody that can actually help people whenever things are really, pandemics and stuff are on the rise, that's really rewarding too. You get to be a big part of healthcare, field that helps people and the more definitely. And it's very exciting, it's very fun, it's very high adrenaline, sometimes it's really fast paced, a lot of pressure, stuff like it's really cool.
Yeah, thank you for sharing, Melissa. You said something really interesting. I did not know that surge techs can help with delivery. That that, like you said, it's like bringing life life into the world, and that honestly sounds really amazing. So thank you for sharing that fact. I honestly had no clue. All right, so moving on to our next portion of our presentation here, we're going to move into our hands-on instruction performed by Melissa. So Melissa will be showing us how surge techs move into getting ready for the surgery.
All right, so I got my sponge ready. I'm just gonna do a little pre-rinse before we do our scrub. You wanna go as high up as 2 inches above your elbow. So I'm gonna use the brush stroke method, which means we're counting how many times I'm actually doing the stroke on the scrub. First, every time you get a sponge, you always gotta clean your nails first before you scrub. So you always wanna start by cleaning each and every one of your nails first. All right, so I cleaned all my nails. Then we're gonna use the scrub side to scrub our nails first for 30 seconds each. So 30 seconds on each hand, you have to scrub your nails first before you start. You go on to the next hand and scrub your nails. Go and get all the dirt under your nails. Dirty strokes. Then after your nails are all clean, then you can start by using the sponge side and start. You have to scrub every single plane of your fingers and your hands and your arms. So you want to start on each finger, do each plane for 10 seconds. Now it's recently changed to 20 seconds. It used to be 10, but just recently they updated. Now it's 20 seconds. 20 strokes per plane. So you're gonna start on your thumb, do 20 on each plane. And make sure you get every single plane of your fingers on all sides. And the good thing about this solution that we use is that not only does it clean it right now that we're scrubbing it, but it continues to kill germs throughout the day. Throughout the next several hours, it continues to kill germs. So that's a good thing. George, does the burning ever get any easier? When you're scrubbing, you feel the burn in your muscles because you're scrubbing a lot, and I still feel the burn. I do the scrub every day.
Well, you get used to it after a while.
They said if it doesn't burn, you're not doing it right. You have to remember once you start scrubbing your hands, you cannot touch any surface. If I accidentally touch anything that I've already scrubbed, I have to start all the way from the beginning. All right, got on my fingers, so I'm gonna do the inside of my hand. The same thing for 20 strokes.
Melissa, I have a question while you're doing that.
Yeah.
Can you wear long nails as a surgical tech?
No, you cannot. You cannot wear nail polish or long nails because it usually harbors like germs under your long nails. So that's not good if you gotta have as clean as you can. So it's not a good idea to have long nails. All right, so after I finish my hand, then I'm gonna break it down to 3 different planes to go 2 inches above my elbow. So each plane is 1, 2, 3, 4. So 4 sides. I'm gonna do 20 strokes each. All right, we'll go to the next one. Next plane. All right, so exactly what I did on this arm is the same thing you're gonna do to your other arm now. So I'll do it real quick and then I'll show you how we ran. So I'll just do one arm just for the sake of this video, so you don't have to wait for me to do the whole other arm. So usually when you rinse, you want to get rid of your sponge, and then when you rinse, you always want to face your arm up, and you never want your arm to go down. You don't ever want the water to drip downwards, so you always want to keep your arm up. So you always start at the bottom on the top. Okay. Rinse. If you need to rinse it again, you want to start again like that. Never go down. And whenever you dry, you want to dry from this part all the way down to cleanest, all the way to the dirtiest. And just dry going down. And that's how you do a surgical hand scrub.
Wow, Melissa, that was so fascinating. I couldn't even say anything because I was just like so amazed. Like I watch it, you know, you watch it on TV, but like actually seeing it in a hospital
Yeah,
setting.
it's really cool because it's usually done by like the sterile team members. Whoever's going to be sterile in the OR, they have to do this at the beginning of their at the beginning of the day, and then once you're in the OR and you're out throughout the cases, then you can just use the Avogard, This right, this is like a solution and it's antiseptic for your hands. So once you do your first scrub, you're just pretty much doing like Avogard throughout the day between cases, unless you need to wash your hands. But this is the main one you have to do at the start of your day, is the surgical hand scrub.
Yeah, well, awesome. Thank you so much for sharing. We'll let you get your hands dry so then you can go ahead and join us for our Q&A session.
Okay, all right.
All right, so let me just go ahead and share my screen with us this one again. All right, and like I said, our floor is now open for a Q&A session, and I think I saw we had some questions during Melissa's hands-on activity. So we can leave the floor open for about 5 to 10 minutes for a Q&A session. So I see there's one question from Jessica Chambers is your skin irritated from all of this scrubbing? So George, would you like to answer, or Melissa?
The scrub brushes have just a sponge side that doesn't really hurt the skin very much. You learn which soaps are good for your hands and which ones aren't. Some people are allergic to different soaps. So um, you kind of develop I don't know, a surgical hand after a while because um, you're always washing them so often. Um, we do that hand scrub first thing in the morning, but then also after lunch, after you go to the restroom, for every single surgery. So I might wash my hand like that 8 times a day if I'm scrubbing in. If you have one big surgery, you only have to do it once or twice a day. So it just depends. Being in healthcare, you wash your hands a lot, and sometimes it can dry them out. But we get used to it after a while.
Nice, yeah. Um, it's a very interesting procedure to definitely do. And like you said, George, after a while, you pretty much just get used to it. But George, I do actually have a question for you because I know in the beginning you mentioned that you were interested, that you actually started out in the IT field. Did you know when you were in high school that you wanted to do a healthcare field, or how did that look for you while you were in high school?
Well, when I was in high school, we didn't have all these great programs that they have nowadays. I think we had drafting, auto shop, cosmetology, and that was pretty much it. So you know, everything we learned was when we went to college later in life. So I'm amazed that the kids have all these options nowadays. Um, I didn't come about until after 8 years in corporate America working high tech. So, I didn't even know about it. And no one in my family was in healthcare. So when I found out about surgical technology, I was kind of blown away that I could learn to do this. You know, I could be right there next to the surgeon when they say knife. I'm the guy that hands the knife to them. So um, it's amazing that y'all have the programs like that now.
Nice. Yeah, that's very interesting. You know, you started in one industry, but then you ended up in another And I think that's very inspiring for our students, especially when they're still deciding exactly what it is that they want to do, that it is possible. You can choose this industry, but hey, if you decide you may like something else, you could definitely switch over um, if that's possible for you. All right, so I see we have another question. It looks like Lauren elaborated on it a little bit. So Melissa, I'll just turn the question over to you. But how do surgical techs learn to communicate with surgeons and other medical professionals?
So I think once you get your training in and you start being familiar with the different types of surgeries there are, as long as you know that what you're doing is correct and you're confident that you're doing your role correctly, then that should improve your communication because you can communicate better when you know what you're doing. So if you're confident and you know that what you're doing is correct, and that helps you be able to speak more like confidently to the surgeons. But there's definitely difficult surgeons. There's definitely some that expect you to know more than what you're coming in to know. There's definitely all types of surgeons. But like I said, I think if you have that confidence that you know you're doing your role correctly, then you feel better responding to them or telling them whatever you need to tell them. But you have to expect sometimes they're going to be in bad moods. They're probably tired sometimes. So sometimes just kind of just learn how to just, if they have that random attitude, you kind of just let it go because you know you're doing what you're supposed to be doing. So I think once you build that confidence and you start getting that experience in, I think then it should be more comfortable for you to be able to communicate with people. But they need us just as importantly. So they don't just completely just treat us like in bad ways sometimes. It's not really like that because they understand that we're part of the surgical team. We're just as important. Our role is just as important. So they kind of have no choice sometimes. Like, yeah, and they understand that they do need us. So they don't always treat us like that. There's bad days, there's great days. So I think just build your confidence, and it helps you communicate with everybody better, everybody's roles.
Yeah, thank you for sharing that. Confidence is definitely important. Like you said, when you know what you're doing, you feel confident when you're speaking to your professionals or your coworkers, whether that be the doctors, nurses, or whomever that may be. All right, so now we're just going to jump into some of the spring updates that we have over at Workforce Solutions Capital Area. And that first one being our teacher externship. So if you haven't heard of it by now, here's your chance to hear about it. So we are rolling out our upcoming teacher externship in June 2021. This is open to all teachers and counselors. And it is a 5-day long externship. First day being an orientation, 3 days of the actual externship, and then your final day is a debrief session. We do require that teachers participate in the entire 5 days just to get the benefit of the entire externship. So if you are interested in participating in an externship, feel free to send me an email. It's my email address is right here on the screen, shannon.scriven@wfscapitalarea.com. And I can definitely share the registration form with you all. But we will also send this PowerPoint out to everyone on this call, just so that you have access to the flyer as well, and you can register for it directly through this link. And if you're not a teacher or a counselor, maybe you're an employer and you want to participate in this teacher externship, we have a space for you as well. If you're an employer who are looking to host a teacher or a counselor for this upcoming summer, again around June 2021, please reach out to my colleague, Jessica Garay. Her email is right here on the screen, jessica.garay@wfscapitalarea.com. And she can definitely share more information with you all on the procedure of how to be enrolled as an employer for our teacher externship. And again, the registration link for that is on my screen as well, which we will share with you all. All right, so moving into our resources for today. So we have the resource, the video that Lauren shared with us from CHCP is Leslie put it into the chat box for us, so thank you so much for that. And then we also have a resource for text-to-taught jobs, the Association of Surgical Technologists and the National Board of Surgical Technology and Surgical Assisting. And another cool thing that I want to share with you guys before we end our call for today is a surgical space simulation. If we have any teachers on the call, this will be a great simulation to share with your students. And just to give you all a sneak peek of what that simulation looks like, let me just share my screen with you all. Right. All right, so do we all see the surgical room here on my screen? Yeah, so this is pretty much what that link is on the PowerPoint. It's a nice simulation you can share with those students who may be interested in going into the surgical tech field. It's a nice little tool to incorporate in your classroom. It shows what the room looks like. You can get into details about what's on the table and whatnot. So it's just a really cool simulation that you can share with your students. And again, we will share this with you all as well so that if you do want to share it, you have access to it as well. All right, and then contact information. If you have any questions about anything that we discussed during this presentation, feel free to reach out to myself. Once again, my name is Shannon Scriven. We have Ashley King, she's our Director of Healthcare Partnerships, and then Leslie Puckett, who is on the call with me. She's our Director of Research and Career Awareness. Feel free to send us an email with any questions you may come along. And whatnot. And I believe Lauren also put her contact information in the chat as well. So if you do have any questions about how to get accepted into CHCP, what type of programs do they offer at CHCP, definitely feel free to ask Lauren any questions you may have about that. All right, and finally for us, again, I just want to say a big thank you to our oh wait, I see we have one last question from Carrie Cooper. All right, so Carrie said, do you recommend that students not try to work a job on the side to make money during the training because of the rigor of the program? George or Melissa, if you guys would like to answer that. I see Lauren is typing into the chat box.
So I have an answer for that. So it depends on if you work with certain organizations that assist with the costs. So I know Workforce helps pay for some of the costs for training programs, but also I actually have a part-time job with Ascension CN. So if you maintain a part-time or full-time job with them while you're in the program, they will help you dramatically with the cost. So I'd say if you definitely want help and you don't want to have that student debt after you're done completing, getting your degree, then I think it's definitely worth maintaining a part-time job. I'm not sure what the like qualifications for Workforce, but I know as an Ascension employee, it helped me dramatically. So yes, I highly recommend if you're able to get in for anything, any position you can get in with this Ascension, I highly recommend it because degrees can be really pricey sometimes, and you'll be graduating with no student debt. So I do recommend it in that circumstance. Yes, I think it's very helpful to have a part-time job when you're going to school because that's what I've been doing.
Nice, thank you. Thank you for sharing, Melissa. George, did you want to elaborate on that question?
I worked when I was in school, just part-time. It just depends on the student, on how much studying they need to do. Some can get away with a part-time job, some need to focus on the school. So, you know, like Melissa was saying, there are a lot of programs to help students. Most employers have tuition reimbursement or some kind of reimbursement to help you while you're in the program. So don't let it be a hindrance. There are lots of assistance out there for you.
Nice. Well, thank you both, well, all of you for sharing. George, Lauren, and Melissa, I see you all answered that question, so thank you so much for that. All right, so if there's no further questions, but we're reaching the end of our presentation. And as I was saying, I want to give a huge thank you to our panelists this morning, taking the time out of your day to join us this morning to speak about the field of surg tech. So again, thank you, George, Lauren, and Melissa. for being here with us today. And Melissa, thank you again for that hands-on simulation. I feel like I want to go try it now, honestly. It looks really cool. And for our audience, if you do need any help with resumes or careers or training, or maybe you want some more information about our TOL on surgical tech, you can email us at careerladder@wfscapitalarea.com. And if you would like to follow us on YouTube, that's WFS Capital Area. We will also post the recording of this webinar on our YouTube channel, just in case maybe your colleague missed it, or maybe some of your students may have missed it. They can watch it on our YouTube channel. And if you do have Facebook, Twitter, Instagram, or LinkedIn, be sure to follow us there as well at WFS Capital Area, just so that you can stay in touch when we post any upcoming events we may have, or any information that may be relevant to you or your students. And I just want to thank our audience for joining us this morning.